I want you to think about the last time you woke up in the morning and your mouth felt like sandpaper, like all the moisture had been completely drained out overnight. You probably reached for a glass of water, took a sip, and moved on with your day without giving it another thought. But here is what I need you to hear right now. If you are over 60 years old and that dry, sticky, parched feeling greets you every single morning, your body may be sending you a warning signal that most people completely ignore, and some doctors even miss at the first visit. Stay with me, because by the end of this, you will understand exactly what that dryness is trying to tell you, what conditions it could be silently connected to, and the specific steps that can genuinely make a difference. This one could change how you look at your mornings forever. I am Dr. Sarah Amal Khalil, and I have spent years working with older adults, sitting across from patients in their 60s, 70s, and 80s, listening to what their bodies are telling them when they cannot quite find the words themselves. And one of the most overlooked symptoms I see consistently across so many patients is morning dry mouth. People dismiss it. They think it is just getting older. They think it is just the air conditioning. They think it is just because they slept with their mouth open. And sometimes, yes, those things play a role. But there is so much more beneath the surface that we need to talk about. Let us start with the basics. Your mouth relies on a steady supply of saliva to stay healthy. Saliva is not just water. It is a complex, living fluid packed with enzymes, proteins, minerals, and antibacterial compounds. It protects your teeth, helps you digest food from the very first bite, keeps the lining of your mouth soft and intact, and forms a barrier against harmful bacteria and fungi. When that supply drops, when your salivary glands are not producing enough, everything suffers. And the older you get, the more vulnerable that system becomes. Now, here's the first thing I want you to understand. Dry mouth is not just uncomfortable. It is not just a nuisance. In the medical world, we call it xerostomia, which simply means a subjective feeling of oral dryness. And in older adults, it is far more common than most people realize. Studies suggest that anywhere from 30 to 40% of people over 65 experience it regularly. But the number who understand why it is happening or what to do about it is dramatically smaller. And that gap right there, that is where the real danger lives. So why does this happen more as we age? Several reasons work together. First, the salivary glands themselves can change with age. They may produce saliva less efficiently. The tissue can become slightly atrophied over decades. This does not happen in everyone, but it is a real physiological shift in many older adults. Second, and this is the big one that I cannot stress enough, medications. If you are over 60 and you take even one prescription medication daily, listen very carefully. Dry mouth is a side effect of over 500 commonly prescribed drugs. 500. That number shocks most of my patients when I tell them. We are talking about medications for high blood pressure, depression, anxiety, allergies, bladder control, Parkinson's disease, diabetes, acid reflux, and so many more. Some of the most widely used medications among older adults are also some of the biggest offenders when it comes to suppressing saliva production. And when you take multiple medications, which many people over 60 do, the dryness compounds. But here's the part that almost nobody talks about, and I want you to really pay attention here, because this is where morning dry mouth becomes more than just a mouth problem. Your mouth is the gateway to your entire body. The health of your oral environment is deeply, scientifically connected to your cardiovascular system, your immune function, your blood sugar regulation, and even your cognitive health. When your mouth is consistently dry, the protective barrier that saliva provides is weakened. Harmful bacteria that would normally be washed away by saliva start to multiply. And those bacteria do not stay in your mouth. They can enter your bloodstream. Research has linked chronic oral dryness and the resulting bacterial overgrowth to increased risk of gum disease, And gum disease, periodontitis, has been associated in multiple studies with higher rates of heart disease, stroke, and poorly controlled diabetes. This is not alarmist speculation. This is established science that the dental and medical communities are increasingly taking seriously. So when you wake up with that dry, sticky morning mouth every day and you ignore it, you may be missing an opportunity to catch something important before it escalates. And I want you to have that opportunity. I want you to be the person who knew to pay attention. Now let us go deeper because there are specific conditions I want to walk you through. Things that morning dry mouth can be a signal for, and each one deserves your attention. The first is Sjogren's syndrome. This is an autoimmune condition in which your immune system mistakenly attacks the glands that produce moisture, including your salivary glands and your tear glands. The two hallmark symptoms are dry mouth and dry eyes. It disproportionately affects women, particularly after menopause, and it is frequently underdiagnosed because its early symptoms can be subtle and easy to dismiss. Many people with Sjogren's syndrome go years without a diagnosis. They think their dry mouth is just aging. They think their dry eyes are just from screen time. But if you are a woman over 60 and you are experiencing persistent dryness in both your mouth and your eyes, this is worth raising with your doctor. A simple blood test can begin the process of evaluation. The second condition I want to bring to your attention is diabetes, both diagnosed and, importantly, undiagnosed. High blood sugar draws fluid out of the tissues throughout your body, including the tissues of your mouth. This is why dry mouth is one of the early warning signs of both type 1 and type 2 diabetes. If you have not had your blood sugar checked recently, or if your diabetes management has been difficult, chronic dry mouth is your body waving a flag. It is saying, something in my metabolic environment is off. Pay attention to that flag. Third, sleep apnea. This one surprises a lot of people. If you are waking up with a very dry mouth, specifically in the morning, and you also feel fatigued during the day, or your partner has mentioned that you snore or seem to stop breathing at night, sleep apnea is absolutely something to consider. When breathing is obstructed during sleep, the body compensates by breathing through the mouth. Mouth breathing dramatically accelerates moisture evaporation. People with undiagnosed sleep apnea often report waking with severe dry mouth, sometimes accompanied by a headache or a sore throat. And sleep apnea itself carries significant cardiovascular and cognitive risks that make it very important to identify and treat. If this is already connecting some dots for you, and I hope it is, do one quick thing right now. Subscribe to this channel. Because I share science-backed health content like this every single week, specifically designed for people who want to understand what their bodies are telling them as they get older. You do not want to miss what is coming next. Hit that subscribe button and stay with me because we are just getting to the section that most people find the most surprising of all. Fourth on my list, and this one is close to my heart as a geriatrician, is the connection between dry mouth and cognitive health. There is growing research suggesting a relationship between chronic oral inflammation, the kind that dry mouth can encourage, and cognitive decline in older adults. One pathway researchers are exploring involves a specific bacteria called Porphyromonas gingivalis, which is primarily associated with gum disease. In multiple studies, this bacteria and its toxic byproducts have been detected in the brains of people with Alzheimer's disease. Now, this does not mean that dry mouth causes Alzheimer's. Research in this area is still evolving. But it does underscore the importance of maintaining oral health as part of your broader strategy for healthy aging. Your mouth is not separate from your brain. They are part of the same system, and what happens in one can influence the other. Fifth, kidney function. The kidneys regulate fluid balance in your body. When kidney function is declining, even mildly, in what we call chronic kidney disease. One of the early symptoms can be a persistent feeling of dryness, including in the mouth. This is partly because the kidneys are less efficient at retaining the right balance of fluids, and partly because kidney disease can lead to uremic compounds building up in the body that affect saliva composition and the sensation in the mouth. If dry mouth is accompanied by fatigue, frequent urination, or swelling in your legs and feet, kidney function is worth evaluating. Now, I want to spend a moment on something practical and positive, because this conversation is not meant to frighten you. It is meant to empower you. So let us talk about what you can actually do. The first and most important step is what I call the medication review. If you are taking any medications, and especially if you are taking several, make an appointment specifically to review your medications with your primary care doctor or pharmacist. Ask this exact question: are any of my current medications contributing to dry mouth? You would be surprised how often a simple adjustment, a lower dose, a different formulation, or switching to an alternative drug can make a significant difference. Never stop or adjust medications on your own, but advocating for yourself in that conversation is both smart and completely appropriate. Second, hydration strategy. I know, everyone tells you to drink more water, but there is a right way and a less effective way to hydrate when dealing with dry mouth. Sipping water consistently throughout the day is far more effective than drinking large amounts at once. Keep a glass of water on your nightstand and take a few sips before you even get out of bed in the morning. Avoid caffeine and alcohol in the hours before sleep. Both are dehydrating and can worsen morning dryness significantly. Limit sodium in the evenings for the same reason. Third, breathe through your nose. This sounds simple, but it is genuinely powerful. Nose breathing filters and humidifies air before it reaches your airways. Mouth breathing during sleep is one of the most direct causes of waking dry mouth. If nasal congestion is forcing you to breathe through your mouth, addressing the underlying cause, whether that is allergies, a deviated septum, or inflammation, can dramatically improve your morning symptoms. A saline nasal rinse at night is a gentle, safe tool many people find helpful. Fourth, oral hygiene adjustments. When saliva is reduced, your teeth and gums are at much higher risk. Bacteria accumulate faster. Acids are not neutralized as effectively. Cavities and gum disease can progress more rapidly. So if you are dealing with dry mouth, this is the time to be more intentional about your oral care. Brush twice daily with a fluoride toothpaste, floss daily, and consider adding an alcohol-free mouthwash. The alcohol-free part matters because alcohol-based mouthwashes actually worsen dryness. Look for mouthwashes formulated specifically for dry mouth. They often contain xylitol or enzymes that mimic some functions of saliva. Fifth, saliva substitutes and stimulants. There are over-the-counter products specifically designed for dry mouth relief. Mouth sprays, gels, and rinses that act as saliva substitutes can provide short-term comfort, particularly at night. Chewing sugar-free gum or sucking on sugar-free candies stimulates your natural saliva production through the chewing action. Again, look for products with xylitol, which has the added benefit of being antibacterial. Avoid products with sugar, as these accelerate tooth decay in a dry mouth environment. Sixth, your sleeping environment. A humidifier in your bedroom can make a noticeable difference, especially in dry climates or during winter months when indoor heating removes moisture from the air. Keeping your bedroom environment at a comfortable humidity level, generally between 40 and 50%, helps reduce the rate at which moisture evaporates from your mouth and airways during sleep. Now, I want to circle back to something I said near the beginning, because I planted a question in your mind and I want to pay it off completely. I told you that morning dry mouth could be a silent sign that many people ignore. And I want you to understand exactly why I use the word silent. It is silent because dry mouth does not scream at you. It does not cause immediate sharp pain. It does not send you rushing to the emergency room. It whispers. It is easy to rationalize away. It is easy to attribute to something harmless. And that quiet, persistent whisper is precisely what makes it so important to listen to. The conditions it can point toward, diabetes, sleep apnea, Sjogren's syndrome, early kidney changes, cardiovascular risk from oral bacteria, all of these benefit enormously from early detection. The earlier you catch them, the more options you have. The more gently they can be managed, the better your quality of life as you move through your 60s, 70s, and beyond. I have patients who came to me with a simple complaint about waking up thirsty every morning. Through that single conversation, we uncovered undiagnosed sleep apnea in one, prediabetes in another, and a medication combination that was quietly damaging a third patient's oral health for over 2 years. 3 different people, 3 different conditions. One shared seemingly minor symptom that they had almost not mentioned because they did not think it was important enough. This is why I am here. This is why I make these videos, because the things that seem small are sometimes the things that matter most. So here is what I want you to do after this video. I want you to take this seriously without panicking. Dry mouth in the morning does not automatically mean something serious is wrong, but it is a conversation worth having with your doctor. Write down when it happens, how severe it feels, whether your eyes also feel dry, whether you feel unusually tired, whether you have noticed any other changes. Bring that list to your next appointment. Be your own advocate. Your doctor can only work with the information you give them, and a single symptom mentioned in passing gets a very different response than a thoughtful, observed pattern you describe clearly. Also, if you have not had a full dental checkup recently, this is your reminder to book one. Your dentist is actually one of the first lines of defense against conditions related to dry mouth. A good dentist will notice the signs of chronic salivary reduction, will screen for oral infections, and can refer you appropriately if needed. Dental care is health care. For people over 60, it is not optional maintenance. It is an essential part of your overall health picture. And one more thing I want to address, because I hear it often. Some of you may be thinking, I already know I have dry mouth. My doctor mentioned it years ago, and they said it was just my medication and there was nothing to be done. I want to gently push back on that framing. There is almost always something that can be done. It may not be a complete cure, but symptom management, oral protection, and monitoring can all be improved with the right approach. If you feel your concern has been dismissed in the past, it is reasonable to ask for a referral to a specialist, whether that is a dentist experienced in dry mouth management, a rheumatologist if Sjogren's is a possibility, a sleep specialist if sleep apnea has not been ruled out, or an endocrinologist if blood sugar control is a concern. You are allowed to advocate for comprehensive care. I want to close with this. Getting older is a privilege, and part of claiming that privilege fully is paying attention to the signals your body sends, even the quiet ones, especially the quiet ones. Your morning dry mouth is not something to be embarrassed about, not something to brush off, and not something to simply accept as inevitable. It is information. Your body is communicating, and now you know how to listen. If this video gave you something valuable today, if it opened your eyes to a symptom you had been dismissing, or gave you the language to have a conversation with your doctor that you had been putting off, then please subscribe to this channel. I post health content every week that is specifically designed for people over 60 who want to age well, stay informed, and feel empowered in their own healthcare. There is so much more I want to share with you about the small signs your body uses to communicate big things, about what science is teaching us about healthy aging, and about the simple, practical steps that make a real difference. Subscribe, Turn on the notification bell so you never miss an upload. And know that every video I make is created with one intention: to give you the knowledge that helps you live better. You watch to the end. That tells me you are someone who takes their health seriously. And that, more than anything, is the most powerful thing you can do for yourself. Take care of your mornings, take care of your mouth, and I will see you in the next one.